10 o'clock, so we'll get started. Hello, everyone, and welcome to the Healing Community Study Learning Collaborative. My name is Lisa Romley, and I'm the Program Educational Coordinator for the HEAL Study. Today, we're here to discuss and learn ways to effectively advocate. I just need to review some housekeeping items before we get started. Just a reminder that the session is being recorded today. And if your screen name is not your full name, either you have a partial name or you're using your phone, if you could please update that now and change it to your full name. This helps when we compare the participants' names in the session to our registration list. We are offering CE credits for today's session. One CE credit has been approved for physicians, pharmacists, nurses, social workers, and licensed drug and alcohol counselors. And I'll give you some information at the end of the session on how to obtain those credits. We do ask that you stay on mute during the session. If you're not speaking, that just helps reduce the echo and extraneous noises. If you have any questions, and we do welcome your questions, we really would like this to be a very interactive session. Please use the raise hand feature, which you can find at the bottom of your screen. You click on reaction and then click on the raised hand, or you can type your questions in the chat box and we will read them during the session. Just to announce that all presenters for today's session have stated that they do not have any relevant financial relationships to disclose. The practice gaps that we have identified is healthcare professionals do not receive training to prepare them to advocate effectively. There is often confusion with understanding the difference between advocacy and lobbying. And the educational needs that will be addressed is understanding that advocacy is essential in creating positive changes, especially for those individuals that are voiceless. Our learning objectives today are describing effective advocacy tools and tips and why it's essential for the health of the community, and also the difference between advocacy and lobbying. So hopefully at the end of today's session, you'll have the understanding of these outcomes. So I'm so pleased to welcome our speakers for today's session. They have a wealth of advocacy experience and are very accomplished. I wish I had time to share all their accomplishments, but I will highlight just some of them. With us today is Dr. Sheila Schuster. She is a licensed clinical psychologist with graduate degrees from Purdue University and University of Louisville. After 27 years of practice as a child psychologist, Dr. Schuster now devotes full-time work to public policy advocacy on mental health and disabilities, healthcare, and social justice issues. Dr. Schuster helped establish and now leads the Kentucky Mental Health Coalition. She was the first executive director for Kentucky Psychological Association and continues to represent that organization. Dr. Schuster currently leads the Advocacy Action Network addressing the healthcare, mental health, social justice, and disability issues. She has been honored by numerous organizations for her advocacy efforts to improve the availability and quality of health and mental health care in the Commonwealth. Dr. Schuster is quick to say that while advocacy is her passion, her grandchildren are her joy. With us also is Emily Beauregard. She became the executive director for Kentucky Voices for Health after years of active coalition membership. And under her leadership, she has led successful campaigns to get more Kentuckians enrolled in healthcare coverage, addressing the many barriers to care and building a strong safety net that meets the basic needs of all Kentuckians. Prior to joining Kentucky Voices for Health, Emily served as Director of Planning and Communication at the Kentucky Primary Care Association, where she worked on practice improvement, community development, policy advocacy, and communication with members and policymakers. Emily holds a master's degree in public health from the University of Illinois at Chicago. And with us also is Cara Stewart. She became the Director of Policy Advocacy for Kentucky Voices for Health in June of 2020. An attorney, Cara worked nearly 7 years as a legal aid of Bluegrass, representing low-income Kentuckians in a wide variety of civil matters with the emphasis on housing. She has published a law review article on landlord-tenant law in Kentucky, And Cara transitioned to the Kentucky Equal Justice Center in 2013 and was able to play a larger role in Kentucky's continuous success with implementation of the Affordable Care Act by conducting community education presentations across the Commonwealth. Cara was appointed by the Governor Steve Beshear to the Kentucky Healthcare Improvement Authority Board in 2017 and was appointed by the Kentucky Bar Association to serve on their committee on child protection and domestic violence. She has received numerous awards for her efforts in community service, healthcare policy, and housing for the homeless. Cara likes to remind everyone that housing is healthcare. A lifelong Kentucky resident, she is a graduate of Salmon Beach Chase College of Law. So I am now going to turn my mic over to Dr. Schuster.
Thank you so much, Lisa, and good morning to you all. We're delighted to have you join us. So we want to make this as effective for you and as interactive. And as Lisa said, please raise your hand or type your questions in the chat so that we can get those as we go along. Next slide, please, Lisa. So this is a group of about 10,000 advocates who came to the Capitol. I always say I wish that were 10,000 psychologists, nurses, healthcare advocates, or whatever. If we were in an open session, I'd say, who do you think it is? And you all would probably guess correctly that it was teachers. Now, interestingly, it was not the most recent kind of uprising of teachers. This was back in the Fletcher administration when teachers came in huge numbers to protest the beginning of pension reform back in those days. I always say to people that teachers have a secret weapon. They can get their superintendents to call off school, and then they can commandeer the school buses and get lots and lots of people to Frankfurt. So think about all the people that you could gather under your tent. We're going to talk about coalition building, about reaching out and educating more and more people about what you're passionate about and the policies that need to be changed. But you can be very effective in small groups, and we're going to talk about that as well. Next, please. So this is the Schuster definition of advocacy, and I call it education with passion. I can't see you all, but I know that you're here because you have a passion around substance use disorders and around trying to get recovery to people and trying to do prevention work and trying to keep our communities healthy and away from the scourge of opioids, fentanyl, heroin, and so forth. So you have a passion about that. You probably have passions about other things that are affected by public policy. And what I will tell you is that the more passionate you are, the more likely you are to be a really good advocate, because you will speak not only from your head in terms of the information, but from your heart. Passion also allows you to be what I've been called, and that is the Energizer Bunny. So persistence is an important part of advocacy, and sometimes it's our passion that keeps us going, even in the face of not being successful immediately. So an advocate is one who listens. And I think it's really important, if you're going to be an advocate, that you really understand where people are coming from. People with lived experience, people who are experts in the field, people who are in maybe ancillary positions but are affected, people in different walks of life. And you bring those voices with your advocacy. You have to be one who can connect. Sometimes we think, well, how does this issue affect the business community? How does this issue affect kids in school? How does this issue affect the business or the faith community? So being able to kind of weave together those tendrils of connections is really, really helpful. You obviously have to be one who is willing and able to speak. And some of our most effective advocates were people that were very reluctant to speak up, to come into Frankfurt, to meet with the legislator, to speak at a hearing, or to speak on an issue publicly, to speak with the media. And you find that once you do it, it gets a little bit easier. So I encourage you to do it, even if you're not 100% sure. But the more you do it, I think the more comfortable you will get. An advocate is one who acts. You have to be willing to get up off your duff and to take action. You can't let this just come to you and act like it's going to happen. We have to be active. So an advocate is anyone who has a passion about an issue or people. And I think I'm talking to I was going to say a room full of people, a whole bunch of people at their computers who are passionate advocates. Next, please. So I want to remind you that a democracy requires that the voice of the people be heard. This is one of our rallies for our 874K coalition. There are 874,000 Kentuckians, according to the 2000 census, that have some kind of disability that interferes with the task of daily living. So I always say to people, we are the largest minority in the state. And if I could get all 874,000 Kentuckians with the same message, we could change almost anything in Frankfurt and probably on up to DC. But if we don't speak out, then there really is not a democracy. If you remain silent and only think your thoughts, but never tell them to an elected official or to their staff member or to the media or to the public, then you're really you are really not part of the democracy. So you've got to be willing to speak up as the voice of the people. Next, please, Lisa. So this is kind of my therapy slide. If I were seeing you in therapy and you came in week after week talking about the same situation, the same group of people that were causing you angst, and after several weeks or several months of that, I would probably say to you at some point, listen, you have to choose to either remain a victim of this situation or you have to choose to influence that system. What happens in Frankfurt affects you, and it's not necessarily all bad. So being victimized by it is not necessarily always a bad thing. But if you're not willing to speak up and to try to influence that system, then all you can do is to be a passive recipient. And I think we want to do more than that. We need more than that for our constituents, for those who have not yet found their voice, and for our communities. Next, please. So advocacy works in this way. Legislators are elected by you, and therefore they are elected to serve you. So I will say to each and every one of you, if you're a resident of Kentucky, you have a state senator and you have a state representative, and you are a constituent of theirs, meaning you live in their district. They have every responsibility to listen to you if you reach out to them. And we're going to talk about how you can make those contacts. Now, I didn't say to call them in the middle of the night, angry and cursing, but there are ways to reach out to them and to express what it is you want them to do. We cannot hold our elected officials accountable unless we speak up and tell them what it is that we need for them to do. Likewise, the governor is elected by you. And by virtue of being elected by you, the entire executive branch is there to serve you. So we don't elect the Secretary of the Cabinet for Health and Family Services, Eric Friedlander, but he is there to serve us because he's appointed by this governor. The same thing with the Office of Drug Control Policy, the Office of Medicaid Services. Any of those governmental branches are there to serve you. But again, you have to be willing to speak up for yourself or for those that you represent who may not yet have a voice. So a democracy requires that the voice of the people be heard, and policy makers are lots of things, but they are not mind readers. So we literally cannot hold them responsible unless we've been very clear with them about what it is that we need to have changed. Next, please. So this is, I'm warning you, this is my guilt slide. This is, if you don't speak out, then who the heck will? This is one of our, when we still had a convention center in Frankfurt, we used to have 1,000 people or so from the disabilities community, people with disabilities, their family members, their caregivers, their providers, and their advocates. And we would gather and invite legislators, invite the governor, invite the cabinet officials to come over and to hear the voices of people as they told their story. What was it that they got that was helpful to them? What were the gaps in services? What were the things that they needed that they did not have? So I will ask you this: who understands the issues better than you do? Doesn't mean you have all of the answers to all of the questions, but chances are that you know more about these issues around substance use disorders and their impact than most legislators do, and whose voice will be heard if you don't speak out. So again, the importance of you being an advocate and stepping forward. Next, please. So that voice should be yours because, again, I think you care and you care passionately. You're knowledgeable about your issues. And again, don't underestimate how much knowledge you have, whether it is as a person with a lived experience, whether it's as a family member of someone with a disability, with a substance use disorder, someone with a lived experience, a provider, someone who's in an advocacy or policy role. You are very knowledgeable about your issues, and you have to be willing to share them with not only decision makers, but with others. And Emily and I are going to talk later about the importance of coalitions, and I think she can demonstrate Kentucky Voices for Health as an example, or the Kentucky Mental Health Coalition, or the 874K Coalition, or our Thrive Kentucky group, where we reach out and essentially educate other people about our issues so that they can get on board, maybe for slightly different reasons, but because their voices will add to ours. You also, that voice should be yours because you're willing to provide accurate and important information. One of the things that I find when I talk to groups about speaking to their legislators is that there's kind of a natural hesitation or concern that if they talk to their legislator, they might get asked a question that they don't know the answer to. And so they kind of step back and say, I don't want to do that. I've been going to Frankfurt since 1978. I always say I started when I was 10 years old. So I was a youngster then and now. I still get asked questions after 44 years of talking to legislators. I still get thrown a curveball every once in a while where I don't know the answer immediately to that question. Let me pose it to you this way. If you're talking with a legislator and they ask you a question you don't know the answer, number one, do not pull an answer out of your left ear. You never want to give legislators or policymakers incorrect or misleading information. But number two, look at it as a golden opportunity to get back in touch with that legislator. So if Senator Jones says something to you about what you're talking about and you say, you know, that's a great question. I don't know the answer to it, but I will research it and get back with you. What's the best way, Senator Jones, to get back in touch with you? And very often at that point, a legislator will give you their cell phone number, will tell you to use an email address that's not the LRC email address that gets so boxed up with lots of emails. They may have a staff person that they're working with or some kind of legislative aide. Some of them have interns during the session, and they will give you that information. And then the responsibility is yours to go on and do your homework and get back with them. But never hesitate to talk to a legislator, even if you don't think that you know all of the answers. You may not even know all of the questions, but I think you will do your best to provide accurate and important information. Next, please. So really important that if you're going to be an advocate, that you also be an active voter. We have found increasingly that legislators, particularly in 2022, which is an election year, will check you out. They'll find out whether you're a voter. They may find out how you're registered in terms of party. They can also find out, and I don't want to spook you, they're not in the voting booth with you, but they can find out how frequently you vote. So as a constituent, your power is that you can vote that legislator to stay in office or to be booted out of office, or you can support them to run for a different office. So you're much more valuable to them than I am. They may know me because I've been up there so long, but I can only vote for my senator and my representative. You have great power as a constituent, but you need to be registered to vote, and you need to encourage others to register to vote. Next, please. So what do you need to be effective? We need to understand the process of policy making. I'm going to take you through a Civics 101, just to remind you of how that process works and why it's important to know where a bill is in that process as we're trying to advocate around it. We need to be able to identify the policymakers, and the Legislative Research Commission, which is kind of the staff arm of the legislature, has made their website very accessible to get information about individual legislators, about committees, about who the staff are for committees, to be able to get the agendas and to be able to look at every single bill and follow the process of every single bill. I think it's important as you start out on your advocacy journey to keep in mind what your goals are. Sometimes we have a long-term goal that's going to take a lot of different policy changes, and we may decide to break that up into smaller, more doable pieces. Sometimes we call that getting your toenail or your foot in the door before you can get your whole policy in. Sometimes you want to go for the whole thing because you can't picture that it's going to be effective breaking it up into short-term goals. You want to know the time frame for the action. Right now, we're in a lull of the legislature as they are recessed for the 10 veto days. It's not over till it's over. There are 2 more days on April 13th and 14th, and a lot will happen in those days. So if you've got a bill you're working on and it has not bitten the dust yet, it may still be alive, and you may want to look at some strategies for keeping it alive. Again, the importance of reaching out and getting others engaged in the fight, whether in formal coalitions or in informal working relationships. Prepare to do defense, and I hope Emily and Cara will talk a little bit about some fantastic defense that we did this year that we're all exhausted from, but also very excited about. Sometimes the best things that happen is that you have killed a bad bill, or in this case, moved a bill from really, really ugly to just bad. And that doesn't sound like a great victory, but when you hear what could have happened and now what will happen, it was well worth the advocacy. And then I want to remind you, and this is not just the psychologist in me, but it's really all about relationships. If your legislator only hears from you in the closing days of the session with a frantic call to save House Bill whatever or Senate Bill whatever, you don't have a working relationship with your legislator. You want to be in touch with them, not just during the session. In fact, you want to be in touch with them when they're not in session. So you have an opportunity for your legislator to get to know you, to know what you're passionate about. You want to be in a position where you're a resource to that legislator. You're not always coming with your hat in your hand or with your hand out asking for help with an issue, but you want to be seen as someone that can be of help to that legislator. So think in terms of these are long-term relationships like you would have with anyone that you're doing business with. And I think that's an important part of our advocacy. And now I'm going to turn it over to Emily from KVH, and she's going to talk about the focus on advocacy. Emily?
Yeah, so one thing I want to just kind of make clear up front is that there will never be a lack of issues to advocate for. So it's really important to focus your advocacy first in order to be effective and to not get overwhelmed. Advocacy can be focused at the individual, the community, state, or national level. And it can also be focused on legislation, the statute that comes out of the legislative branch, or on regulation from the executive branch. A lot of us become interested in advocacy because of something that happens in our personal lives or in our communities, and we want to get involved. Sometimes that's trying to help out a friend, a family member, or a neighbor, and realizing that there's a systemic barrier that can only be removed through a local ordinance, state legislation, or federal law. And that personal experience that you have also makes you a more effective advocate, because it means that you know something very personal about the issue, and you can relate to other people who may also want to work with you on that issue. And that's where you can really start thinking about coalition building. But something else that I've discovered in my work is that there is also, at least not most often, I would say, there's an order to advocating for a particular policy, and it's not always linear. So I'll use the Affordable Care Act as an example because that's work that I've done for years, working on both advocating for the Affordable Care Act to pass and for it to be implemented and to protect it. So, while originally Policy Advocates in Kentucky, and Dr. Schuster was a big part of this, spent years working to pass state health reform through state legislation. And that happened long before there was really a movement in, the nation, more on that national level, where we thought there was going to be a change that would be nationwide, like the Affordable Care Act ended up being, and affecting, state policy as a result. But once the ACA did come along, once there was that national debate going on about health reform, and we knew that Congress was going to be doing something, we recognized that it was really federal policy that we needed to be influencing. And so we had to pivot at that point from state to federal advocacy. And starting in 2008, many advocates in Kentucky began focusing on getting our members of Congress to work on health reform and eventually to pass the Affordable Care Act into law. And then once that happened in 2010, we pivoted pretty quickly to implementing the law in Kentucky. That turned out to require mostly executive branch action to accept federal funding for Medicaid expansion, to create our state-based marketplace, which we call Connect, and to develop the necessary regulations to enact and enforce the law. So that became our focus for a number of years. But eventually, we also needed state legislation to appropriate continued funding in the state budget for Kentucky's share of the Medicaid expansion costs. So that got us back to not just the executive branch, but the legislative branch. And then even bigger picture, and Dr. Schuster alluded to this, health reform is never done, and there's a lot of defense work that goes into what we do to make sure that people have access to healthcare without barriers and that it's affordable for everyone. And we can't say that we have a system today that is working perfectly well for everyone without barriers and that's affordable to everyone. There are countless things that still need to happen to get us to that healthcare system. And in my work, we continually have to protect Medicaid from cuts and other barriers. And these are barriers that can often be enacted through state legislation. CARE is going to talk about House Bill 7. And again, that was kind of what Dr. Schuster was alluding to, the work we've done during this session. But we had a major defense campaign to make sure that there weren't significant cuts to Medicaid and new barriers put in place, as well as SNAP, which is food assistance, and other programs that are administered by the Cabinet for Health and Family Services. But I think the point is that, the work does not stop once the law is passed. It doesn't stop once the law is implemented. Our advocacy continues, and we have to, at different times, take that advocacy kind of approach to a different level or to a different branch of government. And then just speaking of the Affordable Care Act, and knowing that the folks on this webinar are really interested in substance use disorder treatment, and I'm sure a lot of prevention as well. It's important to remember that the reason that SUD and behavioral health became essential health services is because of the Affordable Care Act. And finally, having parity between those services and physical health services. And it took a lot to implement the amount of treatment providers, available to make sure that we could meet that demand. Now that people had coverage for these services, we had to meet the demand. And that was in and of itself a lot of work and continues to be a challenge. But early data found, shortly after the Affordable Care Act, while Medicaid expansion was implemented in Kentucky, that there was a 700% increase in SUD services for Medicaid members alone. So you can see just how critical it is to have that implementation piece and to make sure that we're not only getting the right policy in place, but we're operationalizing it in a way that it's working for Kentuckians. And
Emily, if I might just interject for people that don't know the history, that before the Affordable Care Act, Medicaid did not cover SUD services in Kentucky. We had advocated for that for years and had never been successful in getting our state Medicaid to include. So a picture up till 2010, Medicaid was not covering SUD services.
It was
so
very
not only
limited.
did it bring it in at parity and make it essential, it literally brought substance use disorders into the Medicaid program in
That's
Kentucky.
right. It was limited at the time before 2014 to pregnant women and children.
Right.
So when I say there was a 700% increase, that was because new people were able to get access to services that they couldn't before, and we had more people covered. And we also had the treatment, the providers, because when there's no payer, you don't have providers to provide those services. And by having Medicaid as a payer, not only did it, actually improve access for people with Medicaid coverage, but for everyone in Kentucky who now has, more providers in their community. Yeah, Jinx, Kara. It's obvious that we work together. So just a few things, as you're thinking about how to focus your advocacy, there's some good questions that you can be asking yourself. That is, what is the policy that needs to be changed? Do we start at the local, the state, or the federal level? Who has the power to change that policy? The executive branch, state legislature, Congress? Who do these policymakers listen to? Who are their constituents? Who are the influential decision makers? And most importantly, how can you be one of those people? And what's your role going to be as an advocate on this particular topic? We can go to the next slide. So how do we get started, in identifying what that policy might be and how to move forward with it? I think many of us at some point have helped folks in our communities to access healthcare, food, transportation, housing, substance use disorder treatment, you name it. If you've had that experience, you know that it isn't usually easy. Sometimes it feels downright impossible. And that's when we want to take a really hard look at the policies and the barriers that get in the way of meeting people's basic needs. So when we talk about advocating for systemic change, we're really talking about how we can change the entire system to eliminate barriers or discrimination for everyone. And to do that, we need to really understand what the unmet needs are. We need to understand where the disparities are, really find those gaps in the system. So, again, thinking systemically, rather than just helping one person to overcome a barrier, like helping them to pay a copay or giving them a bus ticket to get an appointment so that they can get to their treatment program, we can work at the state level to eliminate copays for all Medicaid members, which we've done. We can also make applying for non-emergency medical transportation easier for anyone who needs it, which we still need to do. But once you identify those system gaps, you can really start to advocate more effectively. And then at the community level, you can advocate, of course, to your city council, to your board of health, to, for example, pass a smoke-free ordinance or to set up a needle exchange. This past year, most cities in Kentucky have been getting American Rescue Fund or American Rescue Plan Act dollars. That was some of our federal relief money. And these dollars, are coming to communities, and somebody's making decisions about how they're going to be used. And it's important to have a say in how those are spent. One example is that you could advocate for some of those dollars to be spent on building more affordable recovery housing or just any number of things. But we want to make sure that we're, having a say in what those decisions are. Working at the state level with the legislature, with the Cabinet for Health and Family Services or the Kentucky Housing Corporation, you can advocate for improving or expanding many safety net programs that your communities rely on, like Medicaid, SNAP, which is food assistance, and then housing assistance. There are lots of ways that we can sort of focus that advocacy. But aside from, really focusing on a specific policy, another way to advocate is to participate on advisory councils. And these can be led by local or state governments, by hospitals, by MCOs. There are lots of different kinds of organizations or parts of our government that have advisory councils, and being involved can be another way to have a voice. So let's go to the next slide. So when we think about creating more supportive communities and really start thinking about how we build coalitions, we have to again think about what are we going to advocate for? And the best question to ask yourself and others in your community is, what does your community need to be healthy? What strengths and resources already exist in your community that can be part of the solution? How would your community be different if people had their basic needs met? And you may know some of these answers. If you don't, it's really good to get involved in community assessments that are being done in your area by hospitals, by health departments, by area development districts. And by getting involved and really kind of putting your finger on what the community needs, not what people assume your community needs, not what others may want your community to do differently, but really what people in your community need. That will really inform your work and get more people engaged in your work. And the more you engage people, the more you're involved in that process, whether it's by helping to conduct a survey, gathering community input on how spending or new programs can be implemented in your community. The more you engage with people, the more likely they'll be willing, to advocate with you at the state or the federal level if you're going to be working on specific policies. So building those relationships, again, is really key. We can go to the next slide. And then making connections with your policymakers. To be really influential, you have to know that your policymakers, whether those are the ones that are voted into office or the ones that are appointed in positions in the executive branch. So as a constituent, of course, you are powerful because of your vote. If you're a member of a board of health, or if you're serving on an advisory council, you're representing constituents probably of several legislators. And then as a health professional, you may also represent the needs of patients, staff, and the communities that you serve. So it's good to figure out, which of these hats you're wearing. It can often be more than one. And then you can identify the policymakers that you need to connect with. So thinking about who your policymakers are, we often think of them as, those state legislators, members of Congress, which of course they are, but we really shouldn't forget about our other elected policymakers, local council members, school board members, county judge executives. They're all people that, make a lot of the policy in your community. And the more you know them and are able to work with them, the more effective you'll be. And then, policymakers, of course, like I said, aren't just elected to office. Many are appointed to positions in the executive branch. That includes the cabinet secretaries, commissioners of departments like Medicaid, community-based services, insurance, and other officials who are there to create and enact the regulatory side of policies. And while that isn't always as exciting as, passing new laws, how laws are implemented and how they're enforced is really, really important. It doesn't seem as interesting some days to really think about the regulatory side of things, but if you want those laws to be effective, we really have to do that work too. And then where do you find your policymakers? There are lots of tools that you can use to find elected officials. Dr. Schuster mentioned the LRC website where you can find any of your state legislators, but you can also, find local council members, members of Congress, and then for those non-elected leaders, you are going to want to find out which cabinet they work in or which office or department. And there's typically public information about how to contact them. If there's not, you can call the general number and just be asked to be connected to the commissioner of so-and-so, commissioner of Medicaid, for instance, and you'll get their number or talk to their assistant. You'll get an email address and you can connect with them that way and request a meeting. And it's really important to stay connected and to build relationships. And just remember, this is not a one-time deal. The more you reach out, the more you have that ongoing communication with policymakers, the better. We can go to the next slide. Oh, I'm going to turn it back over to Dr. Schuster now.
So historically, when we were educating legislators about policies, we would do policy briefs. They were 10 or 12 pages long. We thought they were wonderful. They had great research in them. They had graphs and charts and so forth. And we used to spend a good bit of money hiring somebody or using some of our own excellent staff to put them together. And then we realized that they were not being read. So we have pretty much gone to the one-pager, the infamous one-pager. One of the things I would suggest you do if you have a kind of policy goal in mind is to make yourself take a single piece of paper and see if you can describe what it is that needs to happen and why in 6 bullet points. So lots of white space, maybe an illustration, a picture of someone with the lived experience or a graph or something. But you want something that a very busy policymaker, whether elected or appointed, can pick up and get your idea pretty quickly by looking at that one pager. We also use scripts, trying to keep the message consistent across speakers so that we have a consistent message about fighting back on House Bill 7 or in trying to pass House Bill 525 for community health workers, so that the legislators are hearing the same words. When we send out a call to action to call the message line, very often we will give people a 1 or 2 sentence, short sentence to say. We found over the years that people are more comfortable if they have a pretty good idea about what that script is. And then when you have your fact sheet or your leave behind, make sure you have your contact information on it. I have been in legislators' offices at the end of a busy day and their desk is littered with things that people have brought to them, and they'll pick up something and they'll say, this is good, but I have no idea who left it with me. And there will be no contact information. So no matter how you do the rest of the sheet, be sure that at the bottom for more information, contact Emily Beauregard, Kentucky Voices for Health, and at least your email address or a phone number. Next, please. So coalitions, I think, are really a good way to get multiple voices together. When we were trying in the year 2000 to go up against the insurance companies, so we were this little band of mental health advocates, and we were going up literally against the Humanas, the Anthems, the United, and so forth, to try to get what we call parity or equality of coverage for mental health and substance use disorders. For years and years, the insurance companies had discriminated against people who had a behavioral health issue. And part of it was that they hid behind the stigma. And as you all know, there's a lot of stigma still around having an addiction, having a mental illness. And so we were trying to educate people. And I found out that by talking to the faith communities that they got very, very interested in this issue. And one of my legislators said to me, what's the deal, Sheila? You know, my minister talked to me about your parity bill. And, you know, what's the interest there? Well, the interest was that it was a social justice issue. Insurers were discriminating against people who had a brain disorder called addiction or mental illness. And the faith community really got engaged. And we had a multi-pronged, multi-action group around that issue. And it was fairly formal. It was Partners for Parity. We started it about 18 months before the session. We got an actuarial study. We had enough money to rent buses and we parked a bus between the annex and the Capitol. You can't do it anymore because they've closed that road. And we had huge signs on either side of the bus, and our bill number, we took advantage of House Bill 268, do not discriminate. So we really hit hard on that discrimination. And the legislators had to walk past that bus with our big sign on it as they went between their offices in the annex and over to the Capitol. You also can do one issue, very quick hits kind of thing. You may have a bill that's of particular interest to a smaller group of people. People are looking for leadership. And if you're willing to take some time to build a group and to get out information to them, I think you will find that people coalesce around these issues. Also include unlikely allies like we did with the faith community. I think one of the entities that we've not taken enough advantage of is the business community. And the Chamber of Commerce has stepped forward on the SUD issues. They've stepped forward on sentencing and on bail. They need people that can join the workforce, and they're looking at it from a very different perspective than maybe we are as providers or as advocates or people with lived experience. But whatever their motivation, they're willing to get in there, and they carry tremendous weight with the legislators. So again, focus on the ultimate decision makers and on those that connect with them. And then one of our colleagues, Rich Seckel with the Kentucky Equal Justice Center, is always talking about the drumbeat or the buzz of events and media and general support. Social media is very important. If you give your campaign a name, I think that's helpful. Keep it out there in the media. And one of the things that will help you with the media is if you have people with lived experience or their family members who are willing to talk to the media. So think about when an issue is talked about in the Courier Journal or the Herald Leader or whatever your local newspaper is, almost always there's a picture of some people and their story. So they want to make it focused on who this issue is affecting. So be thinking as you're going through your campaign, who are some of those people that are willing to talk with the media. Next, please. So I always say, I think they call me the godmother or the grandmother of coalitions. I don't think you can pitch a tent that's big enough to put everybody under it that I think we could get engaged on some of our issues. So get people engaged, get them under your tent, and get them all speaking with the same language. And Emily's going to pick it up now. Thank you.
Yeah, so lifting up the voices of Kentuckians with lived experience is really essential to good advocacy. And it's something that is central to the work that Kentucky Voices for Health does every day. We know that, when the system fails, someone gets hurt, and that is often the story that prompts action. So we can take advantage of that when it happens, but I don't want that to always be our only strategy. But these stories, you hear them every day from the people that you're working with, people in your communities. It could be a family member who can't get drug treatment because they're uninsured or they don't have reliable transportation. It could be a neighbor who has diabetes and can't afford their insulin. So these are personal stories, and they really do tell it best. But the very best, most effective combination is when we combine that personal story with data. And we can say, here's one person's experience, but here's data about how it's affecting all Kentuckians, or, what the cost is, what the impact is long-term. But by putting a face on the story and combining it with data, you have a really, really powerful advocacy tool. Videos are great. They can grab a lot of attention, but there are also other ways that we can share stories and really lift up those voices. But I also want to just mention that, while negative stories do prompt that action and can be really effective for just sort of getting attention to an issue and getting mobilizing people, just getting a lot of support and some action going, we also need to be sharing stories of success on a constant sort of continual drumbeat basis to build support for good policy solutions. So what we do at Kentucky Voices is have a drumbeat of messaging. Dr. Schuster mentioned having sort of that script, having everybody kind of on the same page in terms of what they're saying. We also do that, through talking points, through the data, making sure we're all sharing the same sort of numbers and facts and figures. But having a drumbeat and having different members of your coalition or different people that you're working with using that same information really does help to kind of build that level, that foundation of support for certain issues. And you want to keep that going year round. But like I said, when there is a particular problem that you're trying to draw attention to, it can also be really effective to sharing that one individual's story where something fell through the cracks, something didn't work the way it was supposed to, and now we need to get our policymakers' attention and get them to work on a solution. So there are some stories that Kentucky Voices for Health has published, and I'm going to just put a link to that in the chat, our YouTube channel. You can see here not only videos that we publish that I think kind of as a theme promote the value of coverage, the value of Medicaid, of having access to care without barriers in Kentucky, and really also focusing on how we kind of address stigma and stereotypes. But this is the way we kind of do our drumbeat messaging. And then you can also see, at that link, press conferences and webinars that we do. But the stories are really what I wanted to share. And it's also important to think about ways that, a constituent, somebody in your community, can talk with their legislator and share their story. And by connecting their story to what the legislator or the policymaker is there for, solutions, policy solutions, you can really use that as kind of a foot in the door, a way to get their attention and get them thinking about how to solve this problem that their constituent is experiencing. We can go to the next slide. So thinking about how to reach possible partners and allies and to build that coalition, we really need to engage people and the public in multiple ways. It's really important, of course, to always keep a buzz in the press, to use social media as much as possible to connect with your policymakers. And policymakers tend to really love Twitter, but all sorts of social media is good for various reasons. We find that Facebook is still prominent for us at KVH in terms of reaching the public. I know that that's usually an older audience, but it's what works for us now. Of course, the more social media platforms you use, the better, really. But it's important to find, or even probably more often, create opportunities to lift up the voices of the people in your community to make sure that they're having a say in the decisions that affect their health and their well-being. This can happen in a number of ways, all the things that we have kind of bulleted on this list. Town hall meetings, public hearings, collecting comments, making those videos, helping someone share their story with the media, or in a meeting with policymakers. There are lots of ways that we can make sure that we are kind of doing that drumbeat in public, but also making sure that legislators are hearing from not just, our organization or from you or a few people in your community, but from lots of different stakeholders. And these are some great ways of doing that. And we don't all have, the capacity to put on a rally or a press conference, but I will say that press conferences are easier than you might think. We've found it really effective to do them even on, platforms like Zoom or on Facebook Live, and can get a pretty big reach that way. And I think that reporters even find it kind of convenient because they don't necessarily have to drive to a location. So just keep that in mind. If you can't do something really big that takes a lot of production, like a rally, press conferences will get a lot of coverage. And then, of course, calls to action and action alerts. We put these out regularly via email to our networks, also on social media, where we very quickly kind of bullet what the problem is or what the solution is that we're looking for. And then exactly what we're asking people to do. Make a phone call to your legislator, send this email, or sign this letter, and just make it as simple as possible. The easier you make it, the better. Those phone calls and personal visits, of course, are more of the personal touch that is going to be remembered by a policymaker. So if you're trying to build that relationship, if you're really trying to make sure that they know who you are, know the constituents that are affected, you're going to want to go that route. And then testimony in front of a committee or at a public hearing of some sort, again, is a great way to kind of shape the narrative, really put a face to the problem, and you can get some earned media out of that as well. And then Sheila shared some, slogans like that, 268, don't discriminate, and 874K, both really good examples of how you can use color slogans, just make sure that something's very memorable and you're getting attention. So we can go to the next slide. I mentioned, sort of shifting or shaping the narrative. And that is another tactic that is just absolutely critical to making sure that we are kind of pointing out what the existing narrative is and the status quo and why it doesn't work anymore, why we need a change. Earned media can be really effective in helping to kind of shift that narrative. And when, we talked already about, having your talking points, having your data that everyone is using in sort of that drumbeat fashion, that's how we shape the right narrative. And with the advocacy that we do around public assistance programs and behavioral health, substance use disorder, one of the things that we run into all of the time is negative stereotypes and stigma. It's especially true for people who use drugs and alcohol. With COVID now, we hear a lot of misinformation. I think that's really been bleeding over into all aspects of our lives. And so we need to reframe these narratives and help people, see the issue from a different perspective. And again, when you put that face on an issue and you defy those stereotypes, that's really powerful. So you can just think about some of the stereotypes that you hear and then come up with the right language. What do you want people to hear? What do you want people to be saying? Make sure that that language draws on the strengths of your community. And then write up talking points that will keep everybody on message, bring in some of that really good data, the statistics that you want to back it up, and then give that to people as the ingredients that they can use to write a compelling op-ed, a letter to the editor, testimony, or even just using these talking points kind of in daily life in the conversations that you have in your community or with your policymakers so that you can keep reinforcing the right narrative. We can go to the next slide. And as far as making sure that you're, kind of reaching the right people, you want to gather as much information as you can about who the players are, who has a role in, making the change that you're looking for, who has the power, the influence. So meeting with policymakers, we've talked about already. I know it can feel really intimidating, but remember that you are the community expert. Like, I can't emphasize that enough. You are the expert. People who are affected by an issue, people with lived experience, are the experts. And policymakers, they, especially here in Kentucky, if you're a legislator, it's a part-time job. They often, have their own job, that they do sort of on a daily basis and then serve part-time as a legislator. Everybody comes from their own background, their own sort of area of expertise, but they're voting on all types of issues. And so if it's an issue that they're especially not as familiar with, an area, healthcare, for instance, that isn't their area of expertise, they're going to be looking to people who, can fill them in, give them background, explain how these programs and sort of treatments are supposed to work. And so be sure to think of yourself as an expert. Don't discount the experience and the knowledge that you have. And know that they also, policymakers, really need to know what's happening on the ground in their communities. And this is especially true when there's something like a pandemic or a natural disaster. With the pandemic, we know that substance use disorders and just the rate of substance use has increased. Overdoses have increased. We've also seen that suicides have increased. Behavioral health conditions have really been exacerbated. And so the more that you can sort of bring attention to that and share good information about what's happening in your community, what the barriers are, what the impact is of a particular, pandemic or disaster, policymakers will be coming to you for that kind of information, because they need to know that. And if they see you as a resource, they're more likely to reach out or to be responsive when you reach out. So keep that in mind as well. I think I'm going to now turn it back over to Dr. Schuster.
Thanks, Emily. I just want to remind you all that politics really are local. So while the vote may take place in Frankfurt or in DC, it's really your local connection with your local representative and senator. As Emily pointed out, don't overlook the influence of your local mayor, your county judge exec, your fire chief, your police chief. All of those people have influence with those legislators as well. Next, please. So I'm going to go very quickly through how a bill becomes law, because I want to give Cara plenty of time to talk about some specific bills that were in the legislature around SUD, and also to dive into the lobbying versus advocacy. So our famous tulips out in front of our state legislature. Next, please. So you've identified a need. You want to find out if there's a policymaker or maybe several who have addressed this issue in the past. You can actually go to the Legislative Research Commission website. And if you click on bills and you click on this session or previous sessions, there's an index of topics. So there actually is a topic around mental health, and also one around substance abuse. You can look and see who the legislators have been who have filed legislation in the past. That's a good way of getting to know the ones that are interested in this. Be aware of the power of politics and strategic in picking a sponsor. We have a supermajority, that's 3/4 of the members of both the House and the Senate are Republicans. So you're probably better off picking a Republican as a sponsor rather than a Democrat, even if your local representative or senator is a Democrat. What they can do is to sign on to your bill as a primary co-sponsor, because you want it to be bipartisan. And then you want to work with your sponsor on timing, co-sponsors, communicating with leadership, and so forth. Next, please. I think it's really important in this time of hyper-partisanship to remember that actually our issues are not partisan and really not political, but you have to understand the partisanship and the politics of it, because the process to get your policy put into statute or put into regulation is. So the party who holds the majority holds the power, and they are in leadership and they have great influence, as do the committee chairs. Most of the bills that do not pass in a session are not voted down. Let me say that again. Most of the bills that fail in a session, fail because they were never heard. In other words, they were never assigned to a committee, or they never got a hearing in committee. So you've got to be sure that your issue gets out there and that you have the people with influence, either as sponsors or co-sponsors. Next, please. So just to remember, in our Senate, 30 Republicans, 8 Democrats. Senate President is Robert Stivers from Clay County. He is very sensitive to drug overdoses. I think Clay County is one of the poorest counties in the country, actually, and has one of the highest rates of drug overdoses. The minority leader is Morgan McGarvey, minority meaning he's the leader of the Democrats in the legislature, and he's from Louisville. Next, please. So 100 members of the House, and again, it's a 1/4, 3/4 divide, 75 Republicans, 25 Democrats. The Speaker of the House, the leader, is David Osborne from Prospect in Oldham County. as a horse farm owner. And the minority leader is Joni Jenkins. That means she's the leader of the Democrats. Joni has a very personal story where her nephew had wisdom teeth pulled, got addicted to oxycodone as a result of a prescription given to him for pain, and unfortunately died of a drug overdose. And she has led the charge in community work in south part of Louisville, as well as in the legislature. So she has a personal story that she's been willing to share around substance use disorder. Next, please. So we started the session on January 4th. This is a 60-day or long session, and we are right down there toward the end. They're going to come back, excuse me, on April 13th and 14th to override vetoes and to pass some remaining pieces of legislation. They will adjourn by midnight on April 14th. And just a reminder that April 18th is the last day to register to vote in the primary election on May 17th. Next slide, please. So a bill can only become law if it's passed by both the House and the Senate. So remember your civics lesson. And it needs to either be signed by the governor or not vetoed by the governor. Only a member of the General Assembly can introduce legislation. I love it when people say, well, I passed House Bill whatever, and they're an advocate or, so forth. Actually, none of us passed those. We might have worked to get it into language for a bill, and we may have helped move it along the process. Bills can vary in length from only a single line to 100 pages. The budget bills, 269 pages of nothing but numbers. I put that in there because sometimes people will say to me, well, Sheila, this will be an easy bill because it's only this one sentence we want to change. And I always say to them, it may only be one sentence, but it still is the same process. We still have to go through the committee and a floor vote in one chamber and then come over to the other chamber and do the committee and the floor vote. Next, please. So when I first came to Kentucky in 1970, I was amazed to find out that the legislature only met every other year. Most of you are probably too young to remember those days, but in 2000, the voters of Kentucky voted to go to annual sessions, but they made a distinction between a long session of 60 days in the even numbered years when we would do our biannual or two-year budget. And then in the odd numbered years, and I think all sessions are odd, but the sessions in the odd numbered years are 30 days long. And then only the governor can call a special session, and it has to be about one specific issue. So you may remember in September of 2021, there was a 5-day session devoted to COVID and some of the measures around the emergency period in COVID. Next, please. So we began our session, the current session, January 4th. The first actions were around redistricting, which they do every 10 years. That delayed the filing deadline for candidates for state legislative offices. A couple of the redistricting maps are being challenged in court, but they are not being held up in terms of being implemented. We have a budget that's just gone to the governor for his review and probably some line item vetoes. We still have a huge surplus. It's more money than we've ever had to spend in Kentucky. There's $1 billion, that's billion with a B, dollars that have not even been spent yet in this budget. They extended the public health emergency period from January 15th to April 14th. And then they went back and changed it and passed a Senate resolution to end it on March 9th. So that affected reciprocity. I don't know the answer to that. Lisa, do you circulate copies of the slides to folks? It's fine with us if you make those available. So I'll let, yes, Lisa will send those out to everyone. Next slide, please. So I remind myself this every time I drive to Frankfurt during the session, that it's not always a logical and rational process. I keep wanting, it's the cognitive psychologist in me, I keep wanting to make sure that I understand everything that happens. And I don't, I've been going up there for 40 plus years. I'm not sure that anybody really understands everything that happens up there. My other favorite saying is, those who love sausage and the law should watch neither being made. We can have good sausage, we can have good law, but it really depends on what gets into that process. Next, please. So a bill is either given an HB or House bill number or an SB Senate bill number, depending on who your sponsor is and what chamber they belong to. So if you have a House member who introduces your bill on substance use disorders, it gets a House bill number, so it's House Bill 123. If you have a senator doing it, it may be Senate Bill 345. What I want to remind you is that the bill keeps that same number all the way through the process. And people get confused because we send out action alerts and we say, contact these members of the Senate Health and Welfare Committee and ask them to vote yes on House Bill 123. And people are like, well, if it's in the Senate, then it must be Senate Bill 123. No, it keeps the same number. If you switch the number, you may go from a bill on substance use disorders to a bill on pig farming or something. So just remember, and it's important to remember the numbers of the bills when you call the message line. Really helpful if you can be specific about the bill number. If you say, I have a message about the mental health bill. Now, the switchboard operators are great at trying to help you figure out what your bill number is, but really helpful if you can remember that. Next, please. So once a bill is introduced, it's given a number, sent to the Leadership Committee on Committees, and they will decide which committee will hear the bill. The House last session, and they've done it again this session, that Leadership Committee, mostly the 5 Republican leaders in the House, are deciding as soon as the bill is introduced whether it will be killed right then or not. So they are not referring a number of bills even to a committee. So they are dead in the water. They don't even have a chance of being heard or acted on. And unfortunately, most of those bills are being filed by Democratic sponsors, members of the Democratic Party. Probably 95% of the bills that are not assigned to committees have a Democratic sponsor. The chair will actually decide if the bill is actually heard and voted on. And again, if your bill is assigned to a committee and you're just kind of passively waiting for it to be called, that's a bad strategy. You've got to be working with your sponsor. You've got to be talking to the leadership. You've got to be talking to the committee chair to make sure that your bill gets to the top of the pile. Next, please. So the committee meetings are open to the public. That's true most of the time. With COVID, it's been a little bit trickier. And actually, COVID has really done damage to the democratic process. It's much more difficult, particularly if you're opposed to a bill, to have an opportunity to speak on the bill. When the Capitol and the Capitol Annex were completely open to the public, you could go into the committee room and sign in and say you wanted to speak and you wanted to speak against House Bill 123. And if there was time, the chair would typically ask people to come and maybe give them a minute or two to speak. But it's much, much harder to have the voice of the people heard. So really important to get those action alerts out and have you be in touch with the committee members so that they understand the bill. I think I mentioned have been going since 1978. I was asked by the Mental Health Association to go to Frankfurt. I'd never been to Frankfurt to testify on a bill to make sure that psychologists and social workers could be paid by insurance companies for mental health issues, that they could be offered a rider. And I didn't know anything about the process. I could barely find my way to Frankfurt, and I went up. And I'm sure I gave eloquent testimony. But the people they had testifying against the bill were not the insurance executives, which is what I thought they would be. It was local constituents of each member of that banking and insurance committee. So it was very clear to me when I walked in the room that they all knew each other. The people in the audience were going up and talking to the legislators and calling them by their first name. And their message was very simple. When they came up and they said, I own a small auto repair shop, or I own a small farm equipment shop, and my insurance agent says, if you pass this bill, that my insurance rates will go up, my premiums will go up, and I won't be able to afford insurance for my workers. Well, guess who won that vote? I have absolutely repressed the vote. I'm sure they took a vote, but I don't think we got even a single yes vote. So I walked away thinking, and I hate to lose, maybe I'd have just quit ever going to Frankfurt. Instead, I just got fascinated with the process and decided I want to learn how to get things to be done there. And I realized as a psychologist that there were 138 folks in Frankfurt, none of whom were either psychologists or mental health professionals, that were making rules about my practice. So really a problem. I'm going to skip on. Lisa, can you go to slide 44? Because I want Cara to have a chance to talk about bills that are of interest in the legislature. There we go. All right. You're on.
Hi, all. I'm Cara. So that echo is horrible. Okay, maybe it's fixed. So these are laws. So RS is regular session, which was a coded language that I put in, and then I thought, well, that's dumb. Never mind. I can use it to explain. When you see RS, it's regular session, because there's also special sessions, extraordinary sessions. And that's sort of the RSGA, regular session of the General Assembly. That is Kentucky's legislative process. When you see those letters combined up, or as I'm sure if any of you all are on social media, the hashtag KYGA plus the year is how we identify our legislature online. So these are not from this year. This is from last year, but I thought that might be helpful to think about some of the laws that have passed to see if any of them you all have interacted with or seen that they're being implemented right now. So last year, one bill was House Bill 140 by Representative Deanna Frazier. And it was all about telehealth, because a lot of people, when we initially had Senate Bill 150 from 2020, which allowed a lot of telehealth opportunities because of COVID, I'm sure you're shocked to hear that our first shot at that, and it's sort of a big bill with all kinds of pieces and parts, we didn't get all of the telehealth pieces correct. Not even kind of close. And we didn't put in specifically, we being all of us being representative and representative democracy, not we as in you and me right now, didn't put in enough specifics for a lot of the licensing boards. And so, some therapists still told their therapists, you can't do this telehealth, even though this law passed, and a lot of confusion. And so a lot of providers came to Representative Frazier and said, this isn't working. And also I'm only getting paid $20 for something I normally get paid $100 for. What can we do? How do we fix it? And so she put in a bill to make that a lot easier for people to be able to be a telehealth provider. And that means more service opportunities for Kentuckians. And of course, telehealth is very popular. And we do know that data had come out very quickly, because this wasn't a new phenomenon. Other states had data about people checking in with their therapist via text and over the phone quickly. And that can really be helpful. And I'm sure you all know, having ongoing contact with someone in especially recent recovery and new recovery is really, really important. So having providers being able to be paid for that is very helpful. And also, if you see anything that's not working about telehealth that maybe it should be, then now you can know that Representative Frazier might be a person to go to say, hey, I know you've worked on this. I know you did a bill that was good, that helped in this way, but here's what else is still out there we still need to fix. Because once a legislator has filed a bill about something, that shows that they've already invested some subject matter expertise. They already have some networks and connections, and that's a really good place to start. Even if she doesn't represent you, that's a really good place to start to continue improving our telehealth rules or law specifically. All right, the next slide, please. This is again also from last year. We created this reentry technical advisory committee. I hope people who are here right now are participating in that committee. If you're not, please join up. It is, through the Legislative Research Commission is a part of the legislature, but it is a great way to get information directly to legislators and their staff that are working on reentry issues, which of course has a lot to do with substance use disorder services. It is, so these technical advisory committees, we don't have a ton of them, but they are one of the formal channels for everyone to bring technical expertise and put it into the legislative process a little more directly without having to do quite as much relationship building, though you still need to do that for all reasons, just like in regular life. But it's sort of a formal channel that works pretty well. House Bill 97 from 2021 is what I would consider one of our biggest wins, because it was a huge package of how to make it easier for people to get enrolled in Medicaid when they're incarcerated and leaving, making it easier to be able to get directly to SUD treatment, removing a lot of barriers there, and also making sure that people can get IDs when they leave incarceration, which of course is a huge barrier to people's success and recovery, because when you find yourself unable to get a job or unable to get a place to live because you don't have an ID, relapse is if not imminent. I'm sure you all know the numbers better on what kind of a level of heightened risk that is. And then there was one thing that, like, KVH, for example, worked really hard on for years. That was a part of House Bill 97 that may not have seemed obvious to a big reentry bill, and that was lifting the SNAP and TANF drug felony bans. So we had hungry people in Kentucky that had a charge from Florida from 30 years ago. So you've got somebody who's, 60 years old, and when they were 19, they got, charged with some kind of theft of $300 of something. And now they're permanently banned from being able to ever have food support, which I find to be inhumane and also bad policy. So outside of sort of the moral reality there. And so, but that ban was in place, and there was nothing you could do about it. And there was a lot of Kentuckians who were prevented from getting help with food because of that ban. So this lifted that ban built in there. So there's oftentimes little pieces that will fit within a bill that maybe you worked on 100 different ways. We worked on that SNAP drug felony ban so many different ways. And so you just never know when you're going to find a vehicle that it's going to be able to get put into and championed and become law. And the next slide. Now we come to this year. So this year we have Senate Bill 56, which again, I hope that a lot of folks in this call are very familiar with, because we had, you all know how hard it is, or how many creative chutes and ladders approaches that health departments and others have created to be able to get naloxone in people's hands. I live primarily in Northern Kentucky. I can go every Thursday. I can walk to the St. Elizabeth parking lot and pick myself up some fresh Narcan. And that's really easy, and I do it and I keep it, but it's not that easy everywhere in the state. And also Narcan is really expensive, and there are other things. And so the legislature took a swipe at making it easier to get other medications that are also opioid antagonists that have been approved, and trying to make it a little bit easier to get that into the hands of people. So that's what Senate Bill 56 did. I left in the number of votes for it because it's a decent sign that it's a good bill when it's 35-0 and 98-0. When 0 people voted against it, that's a pretty good sign. It's not terrible, because that doesn't happen all that often. And then I can't really, House Bill 7. This was like, I have lots of new gray hairs from House Bill 7, as to anybody who was paying attention, I hope. House Bill 7 was branded by some folks a war on the poor. It was a public benefits reform bill, gigantic bill that did tons of things. And most of them were designed to make it harder to enroll or keep life-saving benefits like access to SNAP or access to Medicaid. And it was designed to, the sponsor who we've worked with on this issue for years, Representative Meade, speaking of building relationships, if he were to see any of the three of us in the hallway, he's talked to us about this and he knows our feelings about it, because we've talked to him about it over and over again for years. He wanted to make sure that there is no fraud in these programs. And I don't think it's actually possible to get to a point where there's no fraud, but I'm very unbothered by the fraud because, it's around 1%. So in the SNAP program, historically, year after year after year, it's around 1%. Kentucky already has the highest number per capita of people doing investigations into folks receiving these benefits. So we're already like basically busting everyone. And we're pretty confident about that because we also have some of the strictest algorithms that let people know if you're using it incorrectly. So I don't want you to think that I'm naive. I'm aware that there are people who receive SNAP benefits who are desperate and have no other options, and also who have addiction, who sell their food benefits. I'm aware of that. Got it. I admit it. But it is such a teeny tiny 1% part of the program that I don't think it's a good policy to spend, tens, if not hundreds of millions of dollars hunting to move that needle from, 0.9% this year to 1.1 next year. Just doesn't seem to make that's not a good public policy, to spend more money than when we could be taking 100% federal dollars and putting food in the mouths of Kentuckians and money into the pockets of grocers. So we focused a lot on that money into the economy with grocers with this bill. But here's an example of, on the one hand, we blocked this bill for 3 out of the last 4 years. It was filed and pushed as the champion bill of House leadership for 3 times, although it was around for 4 years. And the low numbers, that means it's the priority of the leadership of the chamber. So 7 means it's a winner. This same bill has also been House Bill 3 and also been House Bill 1, their number 1 priority. Now it failed as House Bill 1 and House Bill 3, which is a testament to Kentucky advocates just killing it. Then House Bill 7 became law. And on the one hand, you could say, y'all, you just blew it. It failed. But we did not just blow it. We worked our tails off. And I'm actually really proud of where this bill started and where it ended. So it started with a lot of requirements, a work reporting requirement. So even though of the people with Medicaid, I wish I could have you all raise your hands quick enough, but Zoom's so slow that probably won't work. But just think of it over in your head right now of what % of people with Medicaid in Kentucky do you think aren't working and probably should be? Like, they're not a student, they're not a parent with little tiny kids, they're not in a nursing home, they're not a child, and they're not permanently disabled. Like, what % of those people do you think have Medicaid and aren't working? Everybody got a number in their head? Type in the chat if you want. Well, Courtney, spoiler alert, you're right. It is under 10%. It's actually under 2%. It's usually around 1.2. So y'all are smart people. You know what's up in the game. It's a very low percentage of people, because turns out you can't take your Medicaid without underwear. You can't, this idea of living on Medicaid would require much more sophisticated provider fraud than anybody's figured out thus far. So, it's not really a thing. So the idea that we're going to require everyone to constantly prove that they're working with ongoing reporting is a waste of time and energy for everyone. And all that does, which we actually have a real life example of in Arkansas, because Arkansas did have the same paperwork reporting requirement to prove people are working. And we saw that 1 in 4 eligible people who were enrolled and were working, were meeting the requirement, 1 in 4 lost their coverage. And then many of them lost their jobs because they didn't have the medicine that they needed to be able to keep working. So we actually saw a radical reduction in workforce participation as a result of this same requirement. So we were very opposed to it, and we got that removed. So there's a lot of different points. Y'all know the schoolhouse rock deal. So when House Bill 7 went to the House committee, we got some changes there. Big changes. We got some changes around that work reporting requirement. We got changes around the SNAP reporting requirement. When it came out of there, it comes to the House. We got some more changes before the House floor. We got some amendments there. Goes to the Senate committee. We got more changes. The Senate committee changes were pretty dramatic. Now the bill is still bad because it's based on a false premise. It's based on something that's not actually good policy, but it's way less harmful. Then it goes to the Senate floor. We get more changes. Get some big swipes taken out of it, to the point where what's left in there is probably unlawful, and can be taken out with litigation. But hopefully this has taken some of the wind out, to let people not be as concerned about it. We made sure in the changes to that fluctuating income could be considered. We made sure that self-attestation could still be used as a last resort. The bill was changed to allow the cabinet to assign SNAP participants in employment and training, but not require it to have SNAP change reporting requirements, not have to be any change every 10 days, which turns in people like servers reporting every single day. Some changes that made the work reporting requirement for SNAP tied to what the federal law says, which is that if it's impossible because there aren't enough jobs in that county, you can waive that requirement. So all right, we've got now, oops, She just told me to stop up. Okay, next slide. Go fast. You get 30 seconds. One bill you can call about right now is Senate Bill 90, which has passed the House and Senate, but the House version very different from the Senate version. Senate refused to concur to agree with the House, so now it's in limbo, but it's very good. The House version was less good because it said less people. This is deferred prosecution for people with addiction so that they can get treatment and actually get credit for that to sort of pay for whatever crime they had committed, which is much better. All right, next one. Make your phone calls to them. Go to the next one. So whenever you're doing this, making these phone calls, we want to encourage everyone. There's probably no one in Kentucky that is lobbying without knowing it, because you need to be paid to do that. And so you're probably not secretly getting paid to lobby and not know it. And there's also no one who is doing more. People are always scared. People are always behind the line where they need to be. Rarely, and by rarely I mean almost never, is anyone really pushing that envelope where they shouldn't be. And the only one of you is anyone here a member of a civil service or the direct employee of the federal government, because you're the only people that have your First Amendment rights infringed at all. The rest of you all can do what you want when you're not at work. Yes, there are political ramifications. Yes, you might piss your boss off, but those are conversations you can figure out, and I'll help you sort through them. You can go to the next one. So this circle, just look at this, look at the difference. Everybody can and should be doing education about what you know, because you all have expertise that no one else has, or at least no one in the legislature. And then when you're going a little bit more specific into advocacy, I hope you're all doing that. And you can do all of that and make big change without actually going to sit down in a meeting and saying, please vote yes on this bill or no on this bill. But even if you do that, that's still you as a citizen advocating. That's not you lobbying, unless you're doing it on work time and being paid to do it. So there's a lot of opportunities, and you should. And this handout, I know we sent out some other stuff to make sure you can tell the difference. And this is probably what everybody really wanted to talk about. We can go to the next one though. These are great examples, but the most important line there is whether as professionals or private citizens, we can all be advocates. And a lot of this is just internal and deciding where that line is for you and your job. But you should always do both. Because if you're trying to be a professional, even as a frontline worker and doing case management services, if you're not sharing somewhere what's frustrating about that and what rules and laws you're running into that make it difficult, then you're a part of the problem. So you got to share that, because I can't get that expertise. I'm not trying to be mean about it, but I can't know about your job and what makes it frustrating and not work. So I can't go and lobby magically and know how to fix it. So we need subject matter expertise and personal lived experience, and not just of the person in recovery, but also the person working on the transportation and talking to this person and hooking them up with this tech staff or whatever. Those pieces are also, we need lived experience of you to know what can be changed to make this make more sense.
Karen, can I add one thing?
I'm micro machine personing over here. So yeah, please do.
Well, I think the simplest way to know if you're lobbying, the simplest way is if you are lobbying on a specific bill number. If there is a piece of legislation that you are asking a legislator to vote for, yes or no, that is lobbying. Kara and I, Dr. Schuster, we all do that at times. But more often, we can even be talking about a specific bill, or we can be talking just about a program like Medicaid. And we can be advocating and educating by just talking about, giving good information, talking about how things work on the ground, what is working, what isn't working, talking about the need, advocating for improvements or, solutions. But if we're not talking about a specific vote on a bill, we're advocating, we are not lobbying. And I think that is where people get really confused. So advocating is the majority of what we do. Lobbying is very narrowly about passing legislation.
For sure.
We've run over our time, so I'm going to turn it over to Lisa. We've got other slides that you all will have that talk about contacts and so forth. I apologize for going over our time. We had much more to tell than we had time to do it.
This was such great information, so valuable, and a lot of great information that you shared with us today. I am going to share these slides as well as all the resources that this group has shared with me. So I will be sending them out in an email. Also, I will also send out the CE credits and how to obtain those within this next hour. You'll get all that information. I want to be respectful of your time, so I know we went over a few minutes here. But thank you to the panel. I really appreciate your great job that you did in really educating us on advocacy, and really enjoyed it today's session. Thank you all, and have a great day, everybody.